Let me tell you about how do we investigate in a case of infertility. The first and the foremost investigation that we do is semen analysis. It is a very simple, very cheap test available at every pathology lab in India, and this will rule out, if a semen analysis is normal, it will rule out 99% of the male factors in just one test. So this is the first test that we should do. If we have a normal semen analysis report, that means we have ruled out a male factor and we focus all our attention on the female. In the female, the first test that is advisable is doing a basic ultrasound. A basic ultrasound will give us a lot of information about your uterus and your ovaries. And the next that we would like to do is a series of ultrasounds for follicular study. 1 month's follicular study, that means 3 to 4 ultrasound in a month, will tell us whether your ovulation is normal, whether your hormones are normal or not. And if everything seems to be normal, then we will leave you for a normal conception for 2 to 3 months. And if in 2 to 3 months you are not able to conceive, then a test called HSG would be advised to you, which is the test to test your tubes. It is a simple X-ray in which a dye is put and an X-ray is taken. And if tubes are blocked, your doctor might advise you diagnostic laparoscopy. But let me tell you that diagnostic laparoscopy is not a test which is advisable in all the infertility cases. There are only certain indications for doing a laparoscopy in infertility, like in cases where there is known endometriosis, known pelvic factors, hydrosalpinges, tumors, masses, or if your HSG tells us that you have tubal block. These are the cases where laparoscopy is advisable. One very important test for infertility, which should be done very early, is anti-Mullerian hormone. It's a simple blood test available in most of the labs in India. It tells us about how much ovarian reserve you have or how much time you have in your hand. If your AMH is normal, that is between 2 to 6 nanogram per ml, then your treatment of infertility goes stepwise. But if your AMH is low, that is less than 2 nanogram per ml, that means we know that you have less time in your hand and the treatment becomes a little more aggressive than usual. Whatever said and done, all the investigations of infertility should be completed in the initial 1 to 3 months of treatment, and it should not take more than this, because in infertility the most important thing is not wasting time.